time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Whip game cool, make them look like cool. Always play cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireball. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got the
Good morning, good afternoon, good evening, wherever you're watching. Welcome, and I sincerely mean that. Welcome to the Kidney Hub East Africa show. I am half your host, Steve, the kidney nurse, and my other half of the host, Brother Moses, will be joining us in a second. Today, we're going to dive into the world of kidney health and dialysis, okay? We'll be exploring the topic of feeling better with adequate dialysis, okay? You're going to want to stick around to watch this, especially if you got loved ones that just started, or even yourself just started dialysis within the last month or two. So join us as we speak and share and also provide valuable insights to help you understand the importance of adequate dialysis and improving your overall well-being. Okay, this is one topic show that you should be watching because you rarely hear about adequate dialysis and shows talking about it. So sit back, okay, relax, and get ready to learn how you can feel better and live a healthier life with the right dialysis treatment. So welcome to the Kidney Hub East Africa show. And without further ado, let me bring on my co-host all the way from Nairobi, Kenya, the kidney ambassador himself, Brother Moses Kennedy. Brother Moses, good evening. How are you doing today?
I'm good, brother Steve. My week has been great, with great relief, I can say, and all is well.
Uh-huh.
So I'm really glad to join this uh, broadcast today, Kidney Harvest Africa. Yes.
Absolutely. And you mentioned before the show that you were able to, because last week you was mentioning that you had a lot of fluid on. Today you look much better than last week. And you had mentioned before the show that you were able to get an extra treatment, something that is normally not done uh, in Kenya when it comes to dialysis treatment. Is that correct?
Oh, yes. I did. I made just a special arrangement, arrangement in that because I'm trusted, I offered and I promised to pay, but because there was really dire need of having the third one. As you know, last time you could see Steve, I was very puffy. Then come the next day, it was so puffy everywhere. So they couldn't, they would listen to me, and I had the third one.
Yes, and this is not just only pertaining to you, Brother Moses, but thousands of Kenyans that undergo kidney dialysis that may be struggling as well with fluid overload and not able to be as fortunate to be able to get the treatment now and pay later concept because maybe the clinic want their money up front or something like that.
Yeah. Basically, what happens, just like all over, it is recommended that people we have three, but due to the setup, especially in Kenya, where the government only pays for two, it becomes sometimes a challenge with the fluid overload, because especially when it's hot, as it's hot during the day, and I mean the last 2 months it's been really hot to the extent that you need just to cool yourself, and this one increases water level in our body, in our bodies. So what happens, brother Steve? um uh, you one can make arrangement and pay in installment, just for that single one, just to relieve you, not the third every week, no, just once a while, just to relieve you, especially when it is you are in dire need, because our constitution also says that everyone is entitled to uh, to medical emergency. So yes, if you promise and they know you can cooperate, then yes, you can be given a third one.
Wow. Wow. So you had to really be in dire need in order for them to go ahead and give you a third treatment.
Yes, basically, and that one applies to any condition in Kenya. To be attended, it must be in dire need, just like you've mentioned. Absolutely emergency.
Mm.
Yes.
And see, this is again, this is why I participate and do this show because even though I can't help all kidney warriors and Kenyan financially so they can get 3 treatments, um, the next best thing for me to do is try to supplement that with education that can save their lives and help alleviate some discomfort. So Brother Moses, today we're going to talk about feeling better with adequate dialysis, something that I feel that all kidney warriors should be able to feel is to feel better. And unfortunately, this education doesn't get disseminated to the dialysis population that may be starting. They may say, "Oh, you need to come to treatment to feel better. You need to do this," but not explain. As I heard one kidney warrior say, when it comes to education, they want to be explained instead of like talking to somebody, explaining it. Don't just talk to them about it, but explain. I don't know if I'm saying that right. Oh, not talk at them, but talk to them when it comes to education. So, um, is education over at your clinic? Is it accessible, Brother Moses?
Education.
Like kidney disease education, when patients come to the clinic, up on the wall in the lobby, is there any education material or any stands where patients able to get information about their treatment options, and dietary options and stuff like that?
Well, few units have what we call talking walls. The few hanging materials that one can refer to. For example, in my clinic, in my unit, we have something that guides on dietary, what should be eaten and what should be avoided. For example, they say you don't need to eliminate everything, but then there are certain food that you need to avoid. For example, red meat, you need to avoid it. Organ meat, you need to avoid it, and shellfish, you need to avoid it. So yes, the few information that is available, talking walls, but then the information that you go and sit somewhere or you are talked to is not available.
Right. All right, Brother Moses, let's get into this topic because I think it's important and we shouldn't delay this information any longer. So let me set up how this works when it comes to kidneys. When the kidneys don't work, okay, waste products are created from the digestion of food and normal breakdown of body tissue. Okay. Uremia, remember that word. Uremia is the buildup of waste products in the blood when the kidneys are not working right. So when we eat and what we digest, waste products are created from that digestion of food and a normal breakdown of body tissue. And then, as I repeat, uremia, they get that from urine. Uremia is the buildup of waste products in the blood when the kidneys are not working right. Now, dialysis comes into play to remove the waste products that can possibly make you feel better than you did when you had those waste products in your body. Now, let's talk about symptoms of uremia, because some people could be having uremia right now. right now, uremia symptoms, and not even know it. With or without kidney failure. And Brother Moses, I want you to tell me if you experience any of this now or in the beginning when you first was diagnosed. Symptoms of uremia include loss of appetite, nausea, metallic taste in the mouth, change in taste perception, weight loss, tiredness, mental dullness, high blood pressure, and itching. Has anyone watching this broadcast experienced any of these symptoms or experienced them right now with kidney disease? Brother Moses, any comments?
Oh yes, brother Steve. These symptoms are quite silent and might be overlooked. My case, when I was diagnosed, I had I always felt very tired, and then besides being tired, I lost appetite, and for a very long time, from my siblings, family members, you know, they knew that I'm a man who eats less or who doesn't eat. So it was I also took it normal because I completely lost appetite, Steve. The whole day I could get the whole day, but I feel like my stomach is full. So you can imagine how it is. You feel your stomach is full, you've eaten nothing, and you don't feel like eating. Besides, you are very tired. So I really suffered those for a very long time. And everyone knew that this guy doesn't eat. He's a man who doesn't eat. Or even if he eats some food, he takes a small portion, a small ratio. So yes, these signs can also be really overlooked the way I did it.
Yeah, and loss of appetite is the number one symptom up here because I can't tell you how many people reached out to me that said that they don't have an appetite. And what I suggest, which many doctors have suggested to patients and that were on dialysis that I work with, suggest, hey, if you don't have an appetite, you may want to try this prescription called Megase, Megastraw acetate. And this is normally subscribed to people who maybe have cancer or AIDS that lost their appetite. And it brings your appetite back. And so that's what I suggest. So loss of appetite is really big. It's really big. I mean, because if you don't have no appetite and you're not eating, that means you're not bringing in any protein. And we all know protein is very important, especially for someone with a chronic condition. Protein promotes healing, feeling of wellness, energy. So again, let me go over these symptoms of uremia, because you can have uremia symptoms even if you're on dialysis because you may not be getting an adequate treatment. then you start feeling like you did when you first started dialysis. And you wondering what's going on. You ask your technician, you ask the nurse. No one seems to know. So let's go back over these symptoms one more time. Loss of appetite, nausea, metallic taste in the mouth, change in taste perception, weight loss, tiredness, mental dullness, high blood pressure, and itching. And that's another big one as well, itching. So how would you know if you're getting an adequate dialysis, or is your blood getting clean? So one way that they check this is by looking at your KT over V. Like, Steve, what is KT over V? Well, this is a monthly test that calculates how well the blood is being cleaned. If you go to dialysis, your parents or your loved one, look at your monthly labs. And on the back page, you should see the KT over V, 1.1 or 1.2 or point something. And this would tell you if you're getting your blood clean. Now, the goals for KT over V, see, each treatment option got different goals for KT over V. Hemodialysis, the goal 1.2 or greater. That's the lowest they want. That's the national average. They want you to at least have 1.2 or higher. When you go to home dialysis, check this out, 2.0 or higher. 2.0 or higher. Peritoneal dialysis, 1.7 or higher. Now, you may be asking, Steve, why are the numbers higher when you get to home treatment? As I said, home hemo, the goal for the KT over V is 2.0 or higher, and peritoneal, which is home dialysis, 1.7 or higher, whereas in-center hemodialysis, they want you to have a 1.2 or greater. Now, why is that? Because at home, you're doing a much longer treatment. You're doing it much longer than 3 hours, 3:15, 3.5, 4 hours. It's almost like a factory. I kid you not. When you go in center, if your chair not ready, you wait. Or if you sit in there, you come in late, they cut your time. Now you're trying to get 3 hours, 3.5. Are you trying to pull off 3 to 4 liters in 3.5 hours? Constant back and forth. And you got some people who are on dialysis in center with a catheter, hemodialysis catheter that looks like this. And they're only getting 0.8 clearance. They're not even getting an over 1 because their kidney may be malfunctioning, or they have to turn the blood flow rate down to 200, 250 because the catheter's not working. And a lot of patients don't think about that. They just go know that they got a catheter sitting right here and they going for treatment. Brother Moses, any comments that you want to mention about the KT over V goals? Whereas hemodialysis in center, the goal is to have 1.2 or higher. As long as you meet 1.2, you made it. But at home dialysis, they want you to have 2.0 or higher, and peritoneal 1.7 or higher KT over V. So you see how with when you go to in-center, you don't have much room for error. If the doctor says you're going to be 3.5 hours, you only have 3.5 hours to clean your blood for that particular session. And if you decide to get off early or something happened where you only run 3 hours and 15 minutes, whether it's because of you may miss your transportation, you got there late, or you just want to get off early, that's not really enough time to really get an adequate treatment. Any comments, Brother Moses?
Oh yes. Let me just share. Let me just talk about in-center hemodialysis, because the uptake of home dialysis is not as much. I know we do monthly lab works that determines all this, how efficiency you've been dialyzing. But then the question is, do warriors know, or are warriors aware of this measurement, how much you get adequate dialysis? So yes, Brother Steve, I know with the home dial with the in center hemodialysis, the target is not as much high because of maybe challenges. You are not into control as compared to home dialysis, where you can decide to do dialysis daily.
Yeah. And see, that's why you may have some people that go to outpatient dialysis to say, oh, when I finish dialysis, I got to go home and sleep, and I don't feel right until the next day. Dialysis is not designed to do that. And the reason, not unless you have, other comorbidities or other issues going on with you. Because I know people who do dialysis, and when they get off, they go and play golf or do other activities. They don't go home and go to sleep. Now, I know everyone is different. Okay, I know that. But again, I've seen people who go home and do dialysis. They do much longer and more treatments, and they feel like there's nothing wrong with them. That's how clean their blood is. And some people I know that do home dialysis, their clearances are compatible to someone with a kidney transplant when it comes to clearance. So when you go to in-center, you're only able to do so much. And people should be asking, why do I have low KT over V expectations 1.2 or higher? Now, we have patients that be in-center that get KT over V greater than 1.2. Yes. But what I'm saying is you need to watch these numbers monthly. So if you're not feeling good or you feel like crap and you want to know what's going on, check that KT over V, because we're about to get into it. So let's move on, Brother Moses. Adequate dialysis requires 4 things. Adequate dialysis requires 4 things: attending all your dialysis treatment, staying for your full prescribed treatment time, rescheduling the treatment if a usual day is missed. Brother Moses, say if you couldn't go Tuesday, can you reschedule?
Oh yes, you can. You
Okay.
can. It does happen. You can. If you miss your scheduled day, then you can reschedule and maybe the next day or any other day. But it must be a day that suits, because already they are patient in that schedule.
Right.
Yes.
And then the 4th adequate that requires adequate dialysis is taking good care of your dialysis access. Because if your dialysis access is not working properly, you're not going to get a good outcome, especially if one has this catheter and it's not running on the full pump speed. Now, if you're supposed to be on a 400 pump speed, sometimes these catheters can't handle that. And they got to turn the pump speed down to 300. And a lot of times the patients don't know. See, that's the thing about this. The majority of patients, you come to treatment, you got a catheter or the access in your arm, sit in the chair, and you may watch TV, fall asleep, or talk to your neighbor. But the majority of people don't sit around and say, hey, what my blood pump speed at? So if something's going on with your catheter, machine alarming, you wondering why it's alarming, and they say it's the catheter, and you say, oh, okay. You go back to doing what you're doing, they come, and they may turn the blood flow rate down, the pump speed. Next thing you know, you're supposed to be on 400 blood flow rate. Now you're on 300 blood flow rate. No one that's on dialysis, now I ain't gonna say no one, because you always may have that 1%. But many people on dialysis are not thinking about their blood flow rate during treatment. And if you're getting a good treatment, you don't find that out until you start having some of these symptoms, or at the end of the month or the beginning of the month when they do your blood work and you see that your KT over V is not even over 1. And you're like, what does that number mean to me? This is why we do this show. Brother Moses, any comments as what I talked about? The adequate dialysis requires 4 things: attending all dialysis treatments, staying for your full prescribed treatment time, rescheduling the treatment if a usual day is missed, and last but not least, taking good care of your dialysis access. Any comments on that?
Oh yes, brother Steve. When it comes to dialysis adequacy, uh, um, uh, the most important thing also I note, brother Steve, is the pump rate you've just mentioned, because of what need or importance you dialyze at 200 at a speed of pump rate, 200, because it won't help much. The obvious is it won't help much, because the higher the pump rate, the better the clearance. So you are doing each day 200, a speed of 200, and then come next week again 200. You are doing almost nothing.
Mm-hmm.
and and the build-up continues, and your health worsen. So we warriors, we must be very keen when it's come to pump rate. Ask your doctor, why am I doing it at 200 consistently? Why don't I go to 300 or to 500? Yes.
Yes, and again, I cannot overemphasize why Kidney Hub East Africa is important, because many places or many webinars or podcasts, they don't talk about what we're talking about here. You hear people's stories. Now, we talk about that as well, but people's stories are not going to get you better.
Absolutely.
Okay? Hearing people's stories are not going to get you better. Get an adequate education so you know how to stay well is what's going to count. So let's talk about taking good care of dialysis access. Again, this is one access right here that I showed, the catheter. And then patients have access in their arm, whether it's a AV graft, arterial venous graft, which is a man-made tubing, flexible tubing made out of Gore-Tex graft, or it's your own veins, AV fistula, arterial venous fistula, where they sew your artery and vein together to create one large vein. You got to take care of it. So, one, having access procedure done as quickly as possible. And what I mean by that, if your arm, they say your arm is clotted, when you in the chair, you got a cell phone, and they say your arm clotted, or your parent, you get that call, hey, your mom, your dad, arm clotted. Get on that horn and call that surgeon right away. Some people go down to the access center. But if you can go to your surgeon, the guy who created that access. See, you want to go back to the person who made it, not to someone who didn't and got to come in and try to repair someone else's work. You want to go back to the person who put it in. Okay? 2, ensuring the needle sites are being rotated. This is how you take good care of your access. Because for many people who don't rotate their access, you can look at their arm. You see these bumps. Got some people that call them lumps. But the medical name for them are aneurysms. And the reason why aneurysms develop, because you do what we call in this field one-site-itis. Hey, Steve, what is one-site-itis? Going in the same spot, sticking in the same spot each time, not rotating the needle sites. And like, why is that happening? Many people go in the same area because now it doesn't hurt as much as if you go to a new spot each time. And so what ends up happening when you're going in the same area, it weakens that area. And now you got the blood that's coming from the heart, the artery flowing through there, and it's expanding that weak area, causing the aneurysm. So next thing you know, you're walking around, oh, you got these bumps on your arm and they still sticking around the same site because it's easy. You can tell the technician where to go or the nurse. You don't let them tell you where they want to go. You say, hey, put the needle right here. I remember patients used to do that all the time. We had the needle, and the needle had a cap on it, and they bite the cap off and put the cap in their hands and say, here, I want you to stick me right here. And that's after we done cleaned off the area with alcohol. You got to go back over it again. But they tell you where they want you to stick. But most people are not thinking about that. They just want to get on and get the treatment so they can go home. Get out of there. And that's understandable. But at some point, you got to take care of that access. Brother Moses, any comments?
Absolutely. Very true, Brother Steve. If you don't take that proactive action on your treatment, then no one will do it for you.
Exactly.
Because nurses or dialysis technician, they want something easy because they're out there to do their work and go home. In fact, Brother Steve, did you know that even if you are not keen on your time can be stolen? So it is very important, just as far as keeping good access, you must ensure that the needle point are rotated, not same point, same place, simply because that is where it is easier to place it, Brother Steve.
Oh, absolutely. And what ends up happening, Brother Moses, where a lot of people don't realize and understand, if they keep sticking in the same area, at some point you're going to have prolonged bleeding. Possibly, I've seen many warriors have this aneurysm and they go home and it ends up rupturing at home, Brother Moses. Rupturing at home. Thus, the person bleeding at home. And that was the reason why I came up with the help. And it'd be like, what's the help? Well, the help is the, Brother Moses, you probably didn't even know I had this. This is the Home Emergency Lifeline Kit.
Okay, wonderful.
And I don't even advertise it like I should be. Because I'm on here about the education. A lot of people probably never seen me with this. But yeah, we sell these on my website, Brother Moses. It's called
I didn't know that. Oh, yes.
Home Emergency Lifeline Kit. And it comes with gloves, short seal band-aids, 4x4s, a tourniquet, pressure tape. So if you're at home and you start to bleed, you're not running around the house trying to find a towel or trying to find something to stop the bleeding and blood leaking all over the floor and everything. You got this kit at your bedside. And you can do what you need to do to stop the bleeding. I did this because, unfortunately, I've seen so many warriors lose their life at home because of this. Thank you, hey, Brother Jeffrey Corey. Thank you for joining. This is a kidney warrior of mine, Brother Moses. that goes to one of the clinics that I work at. Great brother. He plays the piano. Very, very good musician. Yes. Yes. Thanks, Jeff. I appreciate that. And I hope everything is going well. And also, Jeff, let me say this, just a little side note. I'm working at your clinic on Thursdays and every other Saturday for the month of May. So if you happen to come on the Thursday, I know you MWF, but if you happen to come on the Thursday, you'll see me, or every other Saturday. So back to the show. Now, Brother Moses, let's talk about what not enough dialysis can lead to. Because I know some people who miss treatment. I know some people only come once a week. They say they don't give a damn. They just come in once a week. And it got to the point where they don't even set up for the person because they know that they're not coming. You can see them every Monday or Tuesday, but the rest of the week, you're not going to see them. So let's talk about what not enough dialysis can lead to. Decrease in appetite and energy. If you don't have enough dialysis, that can lead to a decrease in appetite and energy. Also, not enough dialysis can lead to feeling sick and tired, fluid overload, shortness of breath, or edema, which is fluid in the lower ankles or legs, or edema in your hands or your face. More frequent hospitalization. Not enough dialysis can lead to more frequent hospitalization. That's why you ask somebody, damn, I'm always in the hospital. I'm always in the hospital. And then, last but not least, not enough dialysis can lead to a shortened lifespan. A shortened lifespan. We all know that we don't know when our time is up. Whether you got a chronic condition, you don't have a chronic condition, you don't know. I know somebody that's been on dialysis 20 years, still going strong. And I know somebody who worked in dialysis 20 years. And that person didn't wake up. She had to be at work the next day, didn't wake up. Not even sick. Had another co-worker. Went to church on a Wednesday. Came home on the phone, talking to her grandkids, happy. Next thing you know, she had a heart attack. Dialysis technician. So it doesn't matter whether you're on dialysis, off dialysis. We all know we're going to go one day. However, if you're on dialysis, why shorten your lifespan by putting yourself at risk for high potassium, which can cause cardiac arrest, stroke, hypertensive crisis? And then we haven't even talked about warriors who at one point decided to be non-compliant with their treatment, not taking some of the medicine, calcium medicine, and then they get in compliant, get on the transplant list, and then they go get evaluation and find out that they can't get a transplant because they had calcification around their heart. So again, not enough dialysis can lead to decrease in appetite. If you've been going to dialysis, or your parents, your loved ones, and you've been skipping treatments, shorten your treatments, and then a week or 2 weeks later, you notice that you don't have an appetite or energy, look back to see if you shorten your treatment, or you could blame it on that. Feeling sick and tired, fluid overload, shortness of breath, edema, more frequent hospitalizations, and a shortened lifespan. That's right, Jeff. Brother Moses, anything you want to add to that?
Well. Um, it is obvious, Brother Steve, that the benefits of getting that adequate treatment comes with a lot of goodies, because if you are, for example, you are consistent with your treatment, then it means the outcome becomes better. But then if you are not, then definitely you will suffer the consequences, Brother Steve.
Oh, absolutely. And there is consequence, especially like if they call you and say, hey, you need an extra treatment. Nobody wants to go to dialysis 4 times a week if you don't have to. And this is some of the benefits of home dialysis, of getting longer treatment. And so now you're able to control what's going on with your fluid intake, your treatments. So here's some questions to ask your health provider or the dialysis center, or even yourself. Some questions to ask. Do I gain too much fluid weight in between treatments? Do I stay for the entire treatment time? Do I go to all my dialysis treatments? Did I reach my prescribed blood flow rate? Do I feel well? Have I kept all my access appointments? And do I arrive late or do I leave early? Now, let me tell you something. If you arrive late, if you're supposed to be there 3:12, if you're supposed to be there at 3 o'clock, 10 o'clock, or 6, and you come 20 to 30 minutes later, I kid you not, I had an administrator say to us, we had a home rule meeting on Friday. I'm sorry, on Wednesday. Administrator came back from a corporate meeting somewhere out of state. All administrators. If someone arrives late, we got to cut their time. So if you're an hour late, guess what? An hour's getting cut off your time. You're 15 minutes late. If you're supposed to be there at 6, we're supposed to put you on at 6. Or you got a 6:15 chair time. That's what time you're supposed to go on. If you come at 6:45, guess what? They're going to cut your time. You're not going to run your whole time. And they're allowed to do it. It ain't like you can go to your kidney doctor and say, hey, they cut my time. Say, were you late? Yeah, they can cut your time. Now, if you on the machine or you arrive and they late putting you on because some mechanical problem, they technically supposed to give you all your treatment time. Some people happy. Oh, you got to take me off early? You can do it. But you taking off early, you're cutting into your time, your treatment, your life. So, as we come to closure, life with a healthy KT over V. How does that look like? Life with a healthy KT over V. You want to know? This is what life looks like. Feel better, have more energy, become more active, enjoy food, and live longer. And I've seen this happen. I've seen people out there playing golf after dialysis or doing this or doing that. I'm like, what? You don't go home and rest? Nah, man, I got too much energy. Brother Moses, any final words that you want to mention?
Oh yes. This subject is really sensitive, Brother Steve. I think we should next time, maybe some other time again, repeat it, do a repeat of this show, because I realize that is the mother of all good health while on dialysis. Why? Because once you get uh, good dialysis adequacy, then it means you will have improved health, and then life expectancy, I think, is also improved, and then the entirely holistically everything becomes okay without complication. So yes, it is very important to really take note of ensuring that you get adequate dialysis at any moment. So warriors, this is my take when it comes to adequate dialysis. Always talk to your nurse, doctor, so that you get to know why you are not getting the best dialysis. Is it your access? Find out. Is it that you come late to dialysis unit, or is it that you have any particular challenging thing or moment that makes you not get this good, adequate dialysis?
Okay, absolutely, absolutely. Jeff had a question. Which home hemodialysis is beneficial for my own treatment? Next stage or outset? So, Jeff, next stage and outset are dialysis machines. Okay, they're machines. And you just got to compare the two. With the next stage machine, if you travel, you could take it with you. It's easy to move. The outset is not that easy to move. Okay, so certain benefits to each machine, but they both do the same thing. And then, Jeff, you say, how come sometimes when I get off the machine, I feel nauseous or weak? The last time I worked with you, Jeff, because we're pulling a lot of fluid off. All right, and it could be if you're still eating while you're on the machine, that could have a possibility of adding to that as well. Then you say my hand is stiff and fingers. I'm not sure if you got diabetes, but depending on what hand you're talking about as well. If it's the hand that they put an access in, you could be having some issues with the nerves. So it could be many things. I'm just giving some general ideas on what possibly could be. But Brother Moses,
Yeah, I
I got a 15-minute. I'm trying to do it within 30 minutes. I got to go, but I got a bonus education that I want to talk about right quick. I didn't send you anything, but it was mixed in with my papers. And I said, let me go ahead and talk about this right quick. Not quick, but just go over it and not be too long with it. And that is MRSA, or what other people may call it, MRSA. I don't know if you heard of that, Brother Moses, over in Kenya, MRSA or MRSA, but I'm just going to go over what kidney warriors should know about MRSA, because it's out there. It can happen to you. And the more you know, the better you can be prepared to prevent something like MRSA happening to you. So, what is MRSA? Pronounced MER hyphen SAH, MRSA. MRSA stands for methicillin resistant Staphylococcus aureus. So that's where you get the MRSA from. Methicillin resistant Staphylococcus aureus. Now, let's break that down. Staphylococcus aureus, often referred to as staph, is a type of bacteria that is often present on the skin or inside the nose of healthy individuals. If, however, these bacteria get under the skin, an infection can occur. Bloodstream infections or septicemia, urinary tract infections, and pneumonia can also be caused by staph. Now, methicillin is a type of penicillin. Methicillin is a type of penicillin. It was developed in 1959, but later replaced by other penicillin forms. And then the word resistant, okay? The word resistant means that bacteria will no longer be killed by an antibiotic. So, MRSA is therefore a Staphylococcus aureus organism that has become resistant to all penicillins. Okay, let me repeat that. MRSA is therefore a Staphylococcus aureus organism that has become resistant to all penicillins. That's why they give you another antibiotic. Who gets MRSA? Staph infections occur more often in people with weakened immune system. Let me repeat that. Staph infections occur more often in people with weakened immune systems. Persons with chronic illnesses such as diabetes and kidney failure are therefore at a greater risk. Let me repeat that. Persons with chronic illnesses such as diabetes and kidney failure are therefore at a greater risk. So if you got a loved one, a mom, dad, grandma, aunt, uncle, wife, husband, or even yourself, if you have a chronic illness such as diabetes or kidney failure, you're or they are at greater risk of getting MRSA. Also, according to the CDC, Centers for Disease Control, MRSA infections are seen more commonly in healthcare facilities. They are seen more commonly in healthcare facilities like dialysis clinics, nursing homes, hospitals. Now, when a MRSA infection originates outside of the healthcare facility, if you get MRSA outside of the hospital setting or healthcare setting, it is known as community acquired MRSA infection. With this form of MRSA, skin infections, pimples, or boils are usually seen. And let me tell you something. How many people used to get those boils inside your groin area where it becomes sweaty, perspirant, and you see people get a boil and then they put a hot rag on it or sit, we lost Brother Moses, or sit in a hot tub trying to bring it to a head. Or you may have to go to the hospital and get it lanced. So, can MRSA be prevented? That's the question you want to ask if you have a chronic illness. Can it be prevented? Staph aureus infections are more likely to spread from person to person if close skin-to-skin contact is present. Hygiene is poor. Living conditions are crowded, or skin is not intact, meaning you got broken skin area, as seen with cuts and abrasions or at a catheter exit site. We talked about that. You can get staph up there too. That's why it's important that whoever's changing your dressing are changing their gloves and washing their hands. See, if you got a parent at dialysis and don't think about that, and you watching this, you're not there to see if they washing their hands and changing their gloves, working with your parent. To help avoid MRSA infection, this is what you need to be writing down if you're watching this, or put it in your memory bank. So if you, your loved one, your mom or your dad are put in a compromised position where it's possible you can get MRSA, you want to know what you can do to help MRSA be prevented. 1, keep your hands clean by washing thoroughly with soap and water or using an alcohol-based hand sanitizer. We're talking about MRSA and preventing MRSA if you're just joining us. 2, Keep cuts and scrapes clean and covered with a bandage until healed. 3, avoid contact with other person's wound or bandages. 4, avoid sharing personal items such as towels or razors. 5, avoid dialyzing with a hemodialysis catheter. This is what they're talking about. Use only when essential. But if you don't have any veins to get an access in your arm put in, then you're going to have this. And this is why making sure staff is following proper protocol or proper infection control protocol. 6, if a hemodialysis catheter is in place, wear a mask during put on and takeoff. Again, remember, staph is in your nose flares of healthy people. So the technician is cleaning. You want to make sure they got their nose covered so they don't be breathing on the catheter site when it's unexposed. 7, when holding your access site post-treatment. When you're holding it sitting in the chair, wear a glove. Ask them to give you a glove and hold your site and remove it before leaving your chair. Then wash your hands. A lot of people some people hold it, don't put the gloves on, and they hold it, bleed, and they get off and don't wash their hands, just walk out the unit, get their weight, touch the door handle, adios. Wash your hands because you don't know who touched that handle before you. Even if you got to get a glove to wear out to open the door. Can MRSA infections be treated? Yes, absolutely. However, antibiotics other than penicillins can be used to treat MRSA. Treating these infections, however, is sometimes difficult. It may require special antibiotics. Plus, successful treatment may take longer. So following measures to avoid infection is, of course, the best approach. It's the best approach. So with that being said, that concludes the little bonus education on MRSA. Again, no one's going to come on here, especially on a Sunday, and do an hour show and then back it up with some education on something that wasn't even meant to be talked about today. But it's all good. I just hope someone got something from that education pertaining to MRSA. So with that being said, I'd like to thank everyone who joined and watched the broadcast. Miss Christine Fasano Paradiso, thank you and God bless you and keep you in thoughts and prayers. Been on hemodialysis since 2022 because of COVID damaged their kidneys. The COVID damaged her transplanted kidney of 19 years. See, folks, this is what we're talking about. I'd like to thank Miss Elizabeth Oldham. thank you for watching the show. Tanya Flowers, what's going on? Peace and blessings to you. My man Jeff, Corey, thank you, Soldier. I appreciate you watching and your commenting. I definitely appreciate it. And with that being said, I'd like to again thank everyone who watched Kidney Hub East Africa. We hope you got something from this show where we talked about feeling better with adequate dialysis. So you can watch the replay on Steve the Kidney Nurse Facebook page, YouTube channel, and the FIGO Initiative Facebook page. With that being said, I'm Steve the Kidney Nurse, signing off from Washington, D.C. Thank you guys for watching. God bless. Have a great evening. Godspeed. Peace.
Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.